Yeah, I think I think you set a good precedence on like kind of the meta narrative from a regulatory and, just a historical level of how the government has been involved in this. And then I think behind the scenes, like when you peel back the layers, there are there are some topics that bounce around in the consumer space. So like for example, one of the books that was popular several years ago, I think a lot of people in this space, like in the healthcare or in the health insurance space, read this book first. But I've known several people, several consumers, just general population folks who don't operate in this space have read The Price We Pay, which is The Price We Pay, What Broke American Healthcare and How to Fix It by Dr. Marty McCary. He's a John Hopkins surgeon. Like you kind of get to the end of the book and like you feel like you need to take a bath. You just like you're like, man, this is disgusting and gross. And really, like the findings there are that all the investigative like research and that his team did was that there's this whole practice of just opaque pricing and overbilling at the hospital level, at the facility level, the provider level, and then even you know furthermore, there's over treatment, because providers want to get paid on unnecessary screenings, you know, just kind of misaligned profit motives, so on and so forth. And then the other argument, which I don't think it's a big number, but there's the kind of middleman profiteering, which this is what you hear with like the Mark Cubans of the world on the PBM side, right? So you got PBMs, you've got insurance brokers, you've got these like group purchasing organizations, right? And so you get all these hidden fees and these kickbacks. Some of that's more relevant in the group insurance or the employer insurance world than like the individual, but it does happen there. And so, there's really this whole drive or this idea. I think that consumers, and with some of the recent legislation, right, that consumers have started to like, we want more transparent pricing. And some states have tried to enact rules around this, and the hospital systems have found loopholes to get away from it, right? So I guess as like an actuary and someone that's been on that side of it, like do you see those three things, the middleman profiteering, overtreatment, and overbilling? Do you see those types of things as having an impact on why it costs so much, or is it nominal compared to some of the just the regulatory nature of where we're at?
Yeah, I go back to it's actuarial, but it's also economics. Like I go back to, there's a difference between what's wrong on a first principles basis and then like the secondary causes because of that initial problem, right? And so what all the things that you're describing, I would categorize as, there's people that can abuse the system that currently is in place for XYZ, but it doesn't speak to whether or not the system itself is the right system or what's kind of the fundamental problem, right? So if you take like the fundamental problem is what drives costs and efficiency in a normal free market is competition, right? And so like let's take the middleman problem for a second. So you say, oh, the middleman or like the insurance company is taking out of the system, a bunch of dollars, whatever it is, like 10% of the cost, like name a number. Um, well, in a competitive marketplace, it doesn't really matter if they're abusing that or not. Like if they're taking out 10% of the cost, then they're adding 10% of the cost and they're not price competitive and they lose enrollment. And so they have to stop doing that and they have to go back to their competitors, right? And so like we often as Americans, we just forget like basic principles of economics and we just we'll start complaining about certain things without saying like, wait a second, why is it that insurance companies or why is it that these middlemen can get away with stuff like that? Well, I'll name one huge problem. Let's just take employer based coverage. Half of Americans get their insurance through employer based coverage, and your employer covers, 80% or more of the premium. And you only have usually like a $1,000 to $2,000 deductible for employer plans. So you actually aren't exposed to the cost. So what does that mean? It means that health insurance companies or middlemen are not marketing to the employee, they're marketing to the employer. If they were marketing to the employee, they would want to make sure that they're going to be competing on cost, on value, on the quality that you're receiving. If they're marketing to the employer, you got to ask the question, what does the employer want from their healthcare? Well, they just want to attract employees, right? Like you want to attract the best talent. You want to control your costs, yes, but ultimately you have a healthcare benefit plan to make sure that your employers get access. So that's why, what do they usually have? They have big PPO plans. They get the biggest name in the market, right? Because if you go to a new employer, the first thing your wife is asking is like, is our doctor in network? Who's covering it? And you as the employee says to your wife, oh, it's Blue Cross Blue Shield. They got a PPO network. And your wife says, cool, let's take this job. I think we should take this job. Let's take it, right? And so you, that's just one thing to understand, that like there, when an employer is picking the plan, they have different motivations for cost. They have a cost and efficiency. And so you might have like a United or something that can take out extra costs, and maybe they cost more, but it's okay because the employer is willing to take it as a, as a tax deducted expense to attract employees, right? So again, secondary cause of a first principle problem. First principle problem is that the families are not actually the purchasers of healthcare. That's fundamentally the problem. Now, the second thing, let's go to price transparency. Everything is opaque. Everything is out of, this is true. But what is the first principle cause of that? The first principle cause of that is, number one, what we just talked about. People aren't they're not actually competing to like get you to purchase that service. If it's a $30,000 service and you have a $1,000 deductible, who cares whether it's 25,000, 20,000, 30,000? And your employer pays the premium. Who cares, right? They're not actually having to go after you. The second thing is, again, these hospitals are being forced to take the Medicare rates. So for surgery A, Medicare is saying we're going to pay you 10,000. For the hospital, it's actually going to cost them 20,000. So to make up for that, they have to charge 30,000. And so there's this confusion of like, what does this actually cost? Nobody really knows. The hospital is just like, well, I have to make like a nominal profit margin. And I remember I did this study in California. I pulled all the hospital data, and they were making about a 1% operational margin overall statewide if you just like aggregated it. So they're literally just trying to balance that out. So again, are there people that can take advantage of this? Yes. But why are they taking advantage of it? Because we don't have a free market competition system. And number two, 40% of Americans are on a price controlled government plan, which is socialism. And let's just talk about number two for a sec. And we're at like the last stage in our economy on the healthcare side of pushing back against what every other country has done outside the United States, which is a single payer, socialist, federally controlled government program. And it's un-American, right? We're at that last stage, and we have a major problem for those that believe in free markets, which is they want to talk about stuff that you talked about: price transparency, cash pay. They want to come up with solutions that are secondary causes, not first principle problems, right? Okay. This is a big problem because when you have 65 million people on Medicare, that drives a ton of the costs in our healthcare system. And most of those are Republicans. And most of those have free coverage, or not free coverage, but highly, highly subsidized coverage through the federal government, through a socialized program. The only, you know, the only free market side in the political aisle would have to abandon one of their key demographics to do anything about this problem of a socialized, federally run, price controlled market that's making all of these distortions in the first place. So nobody has had the courage, I would argue, on the Republican side to say, how do we fix Medicare to make it actually free market and start to eliminate some of these price distortions? There's nobody that has the courage to do it. So if someone had the courage to do it, I think there are creative ways that you can start to do